Hello, I am Sue Dearden and I'm a solicitor specialising in health and safety with Finch Consulting. I'm here today to talk about the issues for employers with the coronavirus, and here with me is Dr. Steve Cowley.
Yes, I'm Steve Cowley. My background is in health and safety. I'm a chartered health and safety professional, and also my background is in occupational hygiene. So my sort of background spans the area of general occupational health and safety as well as into factors that affect workplace health. We've all heard a lot about it in the media in the last few weeks, and of course at the moment the news is getting fuller every day about outbreaks around the world and the number of cases. In the UK, as of today, Sue, I believe there's been about 13,500 people tested for the virus, and fortunately only about 40 have been tested positive. Doesn't seem to be a terribly strong virus in the sense of the effect it has on people. In the majority of people, the effects seem to be very mild, and it seems to be people with a sort of predisposition to the virus, someone who's already sick, heart disease, a diabetic, for example, is at a higher risk, but it's particularly the elderly who seem to be suffering the worst from this virus. Everybody else seems to be experiencing quite mild symptoms. So, given these circumstances, what, from your perspective, should an employer be thinking about, and what should they be doing?
Yeah, it's a difficult one, and it's not all a health and safety issue. I think there's obviously a huge business impact if you suddenly end up with large swathes of your workforce off sick at one particular time, and there's been in the news as well reports about how it's affecting supply chains and things like that, so that there are business issues. But speaking as a health and safety lawyer, the coronavirus is obviously not something, if it does impact your employees, it's not something that you've generated, and it's not something for which you should be responsible. And I don't think it's something for which you need to fear particularly prosecutions. I think that would be a bit harsh if HSE and local authorities and the like started looking at blaming employers for that. However, there are, of course, duties on employers to take reasonably practicable steps to ensure the health and safety and welfare at work of their staff and of people who may be affected by their business. So I think that thought should be given proactively to what reasonably practicable steps can be taken to minimise the impact, and therefore to protect you from the risk of falling foul of the legislation, breach of duty. And from a legal standpoint, I would suggest, obviously following government advice that's being issued and helping inform your workforce of the safeguards that they can be taken. I think the advice is to cough and sneeze into your elbow, isn't it? Which is quite difficult to do, but and frequent hand washing and using hand sanitizers. Things like that you can inform, educate, provide. I also think that, you know, what you've said about there being vulnerable sectors of society, particularly vulnerable people, it's very difficult as an employer to know who those vulnerable people may be in your workforce. Obviously, you know if somebody's very old. But there are a number of conditions that are hidden. So, for example, you don't necessarily know that somebody's diabetic or has got some sort of immunodeficiency.
So are there privacy issues around this part of
that
what you're saying?
There are, because you can't insist that your employees tell you, but under Section 2 of the Health Safety at Work Act, there is a duty to consult with your workforce. So if you consult with them and about this issue and perhaps suggest that those who might fall into the vulnerable category make themselves known to you so that you can protect them, so that if there is an issue in your workforce, you know who, for example, might need to be working in a different area, or who needs to be sent home as a precaution. There are things I think you can do if you've identified the vulnerable people. So some thought might be given to that. Information, I think. It depends on the business, of course, but limiting work travel, that's, I think, is already happening. You can't influence where people go on holiday, but perhaps if they've been on holiday or away to an area that is particularly hit by the coronavirus, you might think about them having a period at home when they return before they come back into work.
Well, I think what you've said is absolutely right. We've got to take some precautions. We have an obligation to, but we need to be careful not to overreact to the situation. We've got to make sure that we do what is necessary to protect people who we have a responsibility to, but also to remember the size of the problem relative to the population of the UK.
The legal obligation is not an absolute duty to prevent your employees from harm. It's to take reasonably practicable steps. So what you do must be moderated by that.
Yeah, I agree. But obviously, as an employer, if we have an employee that's perhaps been on holiday and come back and feels they've got flu-like symptoms, then we should ask them to stay at home. And once they've notified us, ask them to stay there. And if they have reason to believe that it could be coronavirus, the COVID-19, then they should call 111 or Public Health England, as everyone's being instructed to, and then let us know if indeed it is a positive case. If it is a positive case, then we should inform our workforce, not tell them who's ill, but mention that to people that advise them that there is a case in the workforce, and that we take precautions from now on, and we have taken the appropriate action. And I think what we would do is, perhaps if it's a desk-based job, for example, we might have a deep clean of their workstation, clean the area around. Depending on what type of work they do, the tools they handle, we might suggest that they're cleaned. But again, not overreact. The cleaning is very straightforward. Disinfectants and water, soap and water, alcohol-based cleaners.
Would you go so far as, suppose, for example, an employee has been to Thailand and come back and they're not showing any symptoms? Would you require them to wear a mask in the workforce for 2 weeks?
The general belief is that the masks aren't really doing very much. The advice that the World Health Organization provides is that masks are useful if you're caring for someone with the virus, but for the general population, there isn't much evidence that the masks provide protection or make any difference, really.
Would it be, would another reasonably practical step perhaps be, because there is an issue, isn't there, in having to pay for people who are not sick, but they're sort of in an incubation period of the financial impact on the business of having to pay for that absence. And would you suggest that it would be reasonable to have them in but isolated within the workforce in some way, so they've got much reduced contact with people?
I think we have to be careful what we mean by isolation. I've got this picture of sticking them in a box somewhere. No, I think we would not ask them to be isolated in a separate area, but we might advise it that maybe keep their distance. Yeah, maybe there's precautions that don't get too close to other people till we know everything's okay. Just take the normal precautions, such as you were talking about earlier on.
Yeah.
But again, I don't think we should. I think we could have other issues arising as a result of isolating employees.
I think actually key is that the government advice changes almost daily, and you need to keep referring to it to update, because in fact, if you've got an issue with taking reasonably practicable steps, the first thing anybody would do in looking to enforce the health and safety at work act would be looking at what was known at the time, what was the advice at the time, and what were reasonably practicable steps will be judged by what that guidance was. So follow the guidance current at the time it happens.
Yeah, and the guidance from the government or Public Health England, World Health Organization websites, not from the media.
Yes.
The other, in answer to your question, I think another area we need to think about is employers who have visitors coming to their workplaces. So people in the hospitality sector, in the leisure industry. And generally, people have visitors, and I think we need to have a plan for what we're going to do with respect to precautions to protect the visitors and to protect our staff from the visitors. And I think perhaps we need to not react in such a way we're going to offend people when they arrive as our visitors, but be prepared to ensure we're keeping the areas clean in between visits, depending on the number of people, the footfall we have in our workplace. If we have large numbers, and then maybe every few hours give the door handles with the most hand contact, the handrails that lots of people are using, ask the cleaner to do a little bit of extra cleaning around those areas and make sure they're cleaned with the appropriate type of disinfectant or alcohol-based cleaner. And obviously monitor if we have a visitor and we subsequently get a call to say, oh, you've had a visitor recently who's tested positive, then we would follow the advice from the authorities at the time. Similarly, if our workplace is in an area where there's an outbreak, we take the advice from the authority on the subject at the time. But I'd say I don't think we should overreact. We just need to focus on doing what's necessary to prevent the spread of the virus as much as possible, and be aware of...
There is only so much you can do.
Yeah.
And you're not going to be criticised if you have followed the guidance available. I think it's very easy sometimes to talk about this and come out with sort of wide-ranging advice. Obviously, each workplace is different, and you've got all different industries, and there's no sort of one golden bullet that will fix it for everybody. What's important, I think, is to make sure that you recognise there is a potential issue around at the moment, to risk assess your workplace and how your people are operating, whether there are what can be done to minimise and manage the risk. And if you've got that sort of paper trail, legally speaking, I think you should be fine.
Yeah, I think that's a really good point. The risk assessment, it doesn't have to be a long, voluminous document.
No, or very complicated.
No, it's just something which shows that we've thought through what the likelihood is of something happening, what the consequence would be, and what we're doing to mitigate that.
Yes.
And I think people get a bit carried away with risk assessments sometimes, but it can be just as simple as that thought process is so useful in making us think, well, actually, how likely is this? And if it did happen, what are the consequences from a health and safety point of view, as well as a business risk point of view? So it's good business practice to be doing this. Yeah. And then perhaps have a simple written plan, or even some written guidance we could give to employees in the event of something happening. I don't think we need to give people information now, but just other than general guidance about washing hands. Yeah. And we talk a lot about alcohol rubs, but soap and water is the advice which is coming. It's as the alcohol rubs become less available, then we've got to remind people to use soap and water and good hand washing.
And that's as effective, is it?
Yes.
Yeah.
Yes. Yeah. The advice is either soap and water, good washing with soap and water, not just a quick rinse, but a good thorough wash of the hands. Yeah. And we were having a bit of a laugh, weren't we, Sue, because of the article that we saw in Private Eye a couple of weeks ago, where they were looking at the relative risk of sort of virus infections versus using staircases.
Yeah, more than two deaths a day in the UK from falls down stairs.
Yeah, and I think that helps us keep these sorts of things in perspective.
Yeah.
But it was the punchline that was quite funny.
It was,
where the author has suggested that if you wear a mask, like we do for the virus infections.
A pointless antivirus face mask obscures your vision and risks a fall, so it increases the risk of a fall downstairs. Wearing a mask
increases the risk of a fall downstairs. No, that was good.
Yeah.
So I think, we've got to keep things in perspective. And also, we talked about the relative risk of the flu season annually. Yeah. And we're still getting less cases.
Yes.
And less fatalities than globally we do each year. Yeah.
So that's about it from us, I think.
It is.
Thank you very much.